Greetings, everyone, and welcome to Prep Hour with Steve. My name is Steve McPhail. I'm the Director of OET Online, and wonderful to be broadcasting. Greetings, everyone. Oops, let's get rid of that. Welcome to Prep Hour with Steve. My name is... Just a minute. As usual, one or two glitches. Let's just get that fixed. Where is that noise coming from? Just a moment. I'll just turn off my sound for a sec. All right, everyone, just checking if you can hear me clearly. Just type in a yes. Multiple pages open here. So just type in a yes and type in your location and what time it is. So can everyone hear me? All right, great. Okay, good. Got all the sound off. Thank you, everyone. All right, let's get going. So it's 8 a.m. in Brisbane on the 9th of October. Type in your location and time. And if you're watching the video of this sometime in the future, I hope this finds you well and moving forward in your preparation for OET. All right, I'll just see who's here, everyone. Hello to Dr. Faisal, and thank you for your comments. Hello to Marilyn in Melbourne. Hassan is in Saudi. We have Dr. Faisal's in Pakistan. Hello to Shadi in the UK. Elvis there in the USA with Carolina, welcome. Barathi in Saudi, Azhar in Saudi as well. Hello to Melody in New Zealand. Mohammed in Egypt, and so on. Who else have we got here? Hello to Vivian in Ghana. Wow, great, we're reaching into Africa. Amrutha there in Saudi and Sabithra in UAE, and on and on. People are everywhere, wonderful, all over the world. Isn't it a great thing that we can just be interacting in this way to all different regions? Hello to Kirlos and Dennis in New York. Marriott down there in Sydney, Marion in the Philippines, John in Ireland. Okay, and I haven't even gone on to my other channel yet. Haven't got my Facebook one yet either. So we're broadcasting on OET Online, YouTube, and Facebook, as well as the OET Center, YouTube and Facebook. Thank you to the OET Center for giving us this stream so we can reach you guys. And I'm just doing one final thing before we begin, everyone. All right. Not sure where our Facebook stream is. All right, we'll get going, everyone. So hello to Esther in Zambia as well, and Ice in Jordan. Yes, and as Dr. Zara says, corona-free communication, exactly. There's no virus that can be transmitted online, thank goodness. Okay, now look, today everyone, I'm doing a repeat on our prep hour on paraphrasing that I did 2 weeks ago. The reason I'm doing that repeat is it was done at a different time slot. It was done on a Wednesday at 5 p.m., but today it's at 8 a.m. So we're just targeting different locations because a lot of people couldn't attend the live that wanted to. And also because we had a terrific turnout for this session. So we, you know, well over 400. So we realized we had touched a nerve, and we thought, let's just go through this. So it's the same one as done previously, if you have seen that video. But I'm sure many of you will be watching this for the first time. Okay. All right, Dr. Faisal says, it's my first live lecture after COVID illness. Wow, well done, Dr. Faisal. Hope you're feeling better. And thank you for being on the front line, helping the rest of the world and then going through that yourself. Kudos to you. We have Yahya in Sudan, excellent, and Ayman in Egypt. So we're really connecting to a lot of places. Wonderful. Okay, everyone, let's get started. If you want to know, as I said before, we're on Facebook and YouTube. That's OET Online. And if you want to see about the courses that we offer, check out https://oetonline.net.au. That's where we are. And we do have free trial courses on our website, everyone. So if you want to come out and check out our free trial courses, you can do it all directly via our website. And I'll just pop that link in there, just so you know where we are. This is a direct link, everyone. Just dropping it in there on the channels. Okay. All righty. So paraphrasing, everyone. We've got some great words there. I'll try to respond to your comments as we go. But what is paraphrasing? Well, paraphrasing is an aspect of language where you have to change the words and turn information, perhaps in this case, medical case notes, into a letter, and creating your own original sentences, allowing you to put your voice into that letter and focusing on what you think is important. And that's a classic thing about the OET exam. It's not like other exams where you have to write essays that are just fully creative. OET exam is not creative. It's fact-based. You're given the case notes, and but they are in note form, and you're going to need to transform those case notes into complete sentences, paragraphs, and finally a letter. So lots of steps, everyone. You'll be using synonyms. You'll be using antonyms, which are opposites. You're going to restate or reword, re-script, rewrite, all these re's, everyone. That's what paraphrasing is. You're going to bring in aspects of language, including clauses and new words and phrases and so on. You're going to summarize overall symptoms to keep your word length in the required amount. And you're going to interpret the case notes because you're health professionals. You're going to make it real and understand what that case is, and then put your own little spin, so to speak, on it as to what you want to focus on and your understanding. And all these things are assessed, and they are real skills to develop. Okay, so that's what paraphrasing is. And I've just put together a list of these essential steps for paraphrasing. And I've put this together like this because I thought it would give you a bit of a framework, a bit of an understanding of the process of what you're doing. The more we understand the process, then the more likely it is that we're going to be able to apply it successfully. So this is really for you guys to consider and use for your own writing. So here we go, everyone. The 8 essential steps. So number 1, expand. When you're looking at your case notes, you need to look at which words do you need to add to make a complete sentence. So that's the task says expand on the case notes. What do you expand? Well, the case notes will often have very few articles. That's and the. They're omitted because it's note form. Prepositions in, on, at, with, and so on. Also omitted most of the time, but you'll need to incorporate them. Verbs. We often omit the be verbs, and verbs in general. You'll find case notes contain a lot more nouns and adjectives. So you'll need to add or modify verbs. So that's rule number 1, expand. That's OET 101. Number 2, keep. You're going to have to make a decision. There are a lot of excellent medical words in those case notes because those case notes were written to describe that patient's condition, symptoms, or procedure, or whatever occurred at that time. They were the correct word at the time. So a lot of words you can keep, and obviously a lot of facts as well you can keep. So all these things that you think are relevant, you're going to keep. That's a decision you need to make. Modify, number 3. You need to change words so they fit grammatically. It's not just a copy and paste exercise from the case notes into your letter. That's not what it is. So you've got to modify words so they fit grammatically, and you might change a verb from an active form to a passive. You might say, I prescribed Panadol versus Panadol was prescribed. So you're going to change active to passive as the case may be. You're going to turn certain adjectives into nouns or verbs into nouns to create a degree of formality in your writing. And we've covered that in past prep hours under the topic nominalization. That's important. Use synonyms. A lot of times you might decide to find a different word than in the case notes to summarize what you see or what you read. Especially, this is very true for when you're describing social aspects of the patient's history, but also medical symptoms and things like that. There may be a particular word you want to use. There may be a medical word that summarizes those symptoms concisely, and they're good to use. So synonyms are important. Omit, because a medical referral letter is sent to a particular person, your audience, not all the information in the case notes will be relevant to that person. So you need to tailor your content based on who you're writing to. So you need to have your thinking caps on and make it real and decide what does that patient need to do or need to know to continue the care. So omission is important. Rearrange. When you write your referral letter, don't just follow the order that it came in the case notes. That's not what you need to do. You need to rearrange it into an order that is useful to the reader. So that's part of your selection, that's grouping information, so that you end up with probably more a subject-based style letter where it's organized in a way that the important information is mentioned first, can be chronological, it can be order of importance, it can be subject-based, so all relevant styles, but don't just simply follow the order of the case notes. Number 7, combine. You're going to find these different facts that are relevant, and then they're just notes. You need to put them in sentences. So here's where the language aspect comes in. You need to create compound and complex sentences, use conjunctions to join these sentences, and then you'll be following the correct language use rules. So combining facts is a skill. And then lastly, recheck. This is very important. Does the sentence that you've created based on those case notes match the meaning? Because if you get the meaning wrong, well, Not good, is it? If you read the case notes, but perhaps you don't read them carefully, or perhaps there's a misunderstanding, the vocabulary can be intense. If that happens, that will be a problem. So very important that you ensure that the sentence you create accurately reflects what's written in the case notes. There's no room for creativity here. You're presenting facts. Okay, so that's the 8 essential steps to paraphrasing, everyone. Any questions? If that's crystal clear, just type in CC, crystal clear. Any questions, let me know. But I want you to think about that and apply that to your own writing and make sure that you're doing all those things, everyone, because that's what it's all about. Okay, Nayani says it's crystal clear. Wonderful to see you here, Nayani. Okay, so let's just start with a few easy ones, everyone. So let's do expand. So which words do you need to add to make a complete sentence? So you can see this person, nice image. They've got certain allergies, allergies to fish, allergies to crab, allergies to peanuts, and so on. Maybe that's an allergy to celery, hard to know by the drawing. And she's got rash. She's broken out in a rash. So let's just try this. Mrs. Cope, nil allergies. Now I'll show you the incorrect way. Mrs. Cope has nil allergies. And now that's not expanding well. Nil is Latin, not English. So that's an example of not really correct paraphrasing. How should we write that, everyone? Just type in very simple one, Mrs. Cope, nil allergies. Just type in a sentence, everyone. I won't get to correct them all, but I'll certainly look at the ones that I can. Mrs. Cope has no known allergies. Perfect, Ahmad. Miss Cope has an excellent, Alina. Now, while I'm waiting, I'm just checking if we are on streaming anywhere else. Hungry, you've used a short form there, so you've got to write that in full. Has no known allergies. Good. Yeah, I think we all know that one. It's not too hard. Mrs. Cope has no known allergies, but even no allergies is good. Okay, excellent. That's an easy one, isn't it? Okay, next one, allergies. Mr. Z, codeine, dust mites, sulfur dioxide. What are we going to do here? Now, we've got to decide which of these would we omit. We've got codeine. Which is the odd one out here? I think we're going to say dust mites is the odd one out. So I've got this example. Mr. Z is allergic to codeine, dust mites, and sulfur dioxide. But perhaps we need to omit one. Perhaps one of these doesn't fit here. Have a think about that. Which one would you omit if you were writing this? Osden says the dust. Yeah, that's right. So this is about the omission part, everyone. I'm just checking a few more what things people have written. Osden says Mrs. Cope doesn't have any known allergies. Yes, but just avoid the contraction there. I wouldn't say doesn't, does not. It's more formal. And okay, next one. Mr. Z is known allergic. I see this a lot, Mary, and that's not quite right. Is known allergic? No. Is known to be allergic to codeine and sulfur dioxide would be better. Mr. Des has allergic. No, Alina. Has an allergy. You've got to change the adjective allergic to the noun allergy. Please note, Mr. Z is allergic to codeine and sulfur dioxide. Perfect there, Marley. All right. Sajiv says, Mr. Z is allergic to codeine and dust mites. Yep, if you chose to put dust mites. I've got here thinking perhaps, you know, this is subjective. We can't see the whole history. but I'm just giving you an example of what we can omit. Mr. Z is allergic to codeine and sulfur dioxide. Okay, a lot of people got that right. Well done, everyone. Okay, let's continue. Okay, now we've got, we're going to talk about what we omit, everyone, what we omit. So extra info, and this is the key point, everyone. If you put non-relevant information into your case notes, you're slowing the reader down, everyone. You're slowing the reader down. And that makes it harder to find the key points. So there is a criterion, conciseness and clarity. And if you do add non-relevant information, you will be penalized in this exam. So it's very important that you omit non-relevant information. So what are we going to do here, everyone? Mary Roden, DOB 1909-72. She's a teacher, secondary, history, English. She's an English teacher. Divorced, 2 children. And then we've got born 2005, 2007, non-smoker since children were born, drinks wine occasionally with friends, mainly wine. So what information do you think is non-relevant here? We can't see the full case, so we're just doing a little snapshot here. So there's a bit of flexibility in what we actually include. But just looking at that in general, what would you think? Just type in a few things that you would say, generally speaking, would be non-relevant. Marley says, omit 2 children, non-smoker. But often smoking is possible, but sometimes I often see letters, they do include those social factors of alcohol use and cigarette smoking. Yes, Sarah writes, omission will depend on who you're writing to. Absolutely. So we're generalizing here. Othman says divorced. Absolutely. We don't want to sound any judgmental in any way, so we won't say divorced. And yes, doesn't matter that she's an English teacher. That's not relevant. Okay, so let's have a bit of a look. So this is how you don't do it. Mrs. Roden is a divorced English and history teacher at a secondary school who has 2 children aged 15 and 13 respectively. That's too much information. She stopped smoking when the children were born and enjoys drinking wine with her friends. Are we really interested in where she drinks wine? And look at it, it's 37 words, right? All right. Now, before I show you the correct one, and this is just an example, remember, this could be the final paragraph before the conclusion, just a little bit of background, or it could even be in the introduction. How many different ways can you in the audience, describe the age of the children? So if they're born in 2005 and 2007, and we want to use a synonym, we've got here 15 and 13, so that was good. What's another word to describe 15 and 13? What's a synonym for 15 and 13? A synonym for 15 and 13, everyone. Have a think about that, because it's always nice to show a bit of flexibility with your language. Yeah, teenagers, right? That's it. 2 teenage children. And that's always a good thing to do. So we're going to say here, Miss Roden is a 48-year-old teacher with 2 teenage children. There it is. That's good. Good paraphrasing. That's paraphrasing, everyone. She stopped smoking. When did she stop smoking? 15 years ago. And is a social drinker. Look at that, 21 words. So nearly half the number of words, everyone. And this is paraphrasing. We can do the math. There's a little bit of math involved with OET exam because it's always a timeline. Are you good at math? It can help you express things in this way. We know it says non-smoker since children born, so we can say stop smoking If we're in 2020, the first child was born in 2005, we can say stop smoking 15 years ago. And suddenly you have a completely original paragraph or 2 sentences there. And that's what you want to be trying to do. You want to demonstrate that you can paraphrase this information in your own words. Is that clear, everyone? That's the OET exam. Okay. All right, let's do another one. This is the medication one, everyone. Now we're going to do a couple of things here. We're going to omit. So we have a question here. Which details are not relevant? And then we're going to do a combine. Which facts can be combined to create compound and complex sentences? So we're going to use our conjunctions, and we're going to use like a fanboys conjunction here. That's fanboys is for, and, nor, but, or, yet, and so. That's called your fanboys conjunction. Google that if you want to know more about topic sentences, everyone. That's called our fanboys conjunction. So I'll just type that up for you. Just Google that when you're doing your review, everyone. Fanboys. Very useful because the compound sentence is definitely a sentence you're going to use when you're writing for OET. So we've got this patient here. So let's look at our background. You are a health professional in a community health centre. A patient you have been monitoring is moving to another city to live with his daughter. Okay, so this is like a transfer. You've been monitoring the patient and moving to another city. Little handy hint, everyone. Always look at your notes. Always look at the notes at the top of the task, because that gives you contextual information, and you can often borrow segments from there and rephrase it and put it into your own case notes in your own referral letter to get that, to provide that contextual detail, which is very important. Okay. So let's keep going, everyone. So we got Mr. Edmund, diabetes mellitus, GP prescribed metformin, non-compliant, resents having to take medication, always been healthy. I've got a question for everyone. When you see inverted commas, what does that mean? You often see this in the case notes. Always been healthy. Appears unmotivated, takes medication intermittently, on and off, double doses sometimes. So that's who that person is. All right, and yeah, that's my question to everyone. What does, when we put things in inverted commas, what does that mean? Have a think about that, and I'll bring out how not to do it. Mr. Edmonds, well, there's a grammar error there, an unnecessary apostrophe. Was prescribed metformin by his GP for type 2 diabetes. He said he does not need to take the medication because he's healthy. Look, he just, yep. And he seems to be unmotivated and takes his medication intermittently and sometimes takes double the dose. 42 words, everyone. We need to shorten that. Yep, and everyone's got it. When you see inverted commas, it means the exact words of the patient, exactly hungry. And as Nayani and Marta says as well. So because you were talking to the patient, they use those words. You as a health professional wrote those notes. However, I'd say that's a good opportunity to paraphrase into your own language, into your professional language in your letter. So things like said, this is quite informal. He said, and yes, it's a little bit informal and quite long. So can we do this in a shorter form? Well, I'm going to get you to fill some gaps here, everyone. So here I've crossed out what we don't need to include. Doesn't matter who prescribed the metformin. He just takes it. So remove the GP. Resents having to take the medication. Well, that's part of being non-compliant. That's the example of non-compliant. So you simply put the non-compliance. We can remove he's always been healthy as the reason, again, simply non-compliant. Always been appears unmotivated can be omitted as well because it's the non-compliant aspect. And we can remove takes medication. But the other factors, the double dosing, important, intermittently important. So this is your selection. Mr. Edmund takes metformin for type 2 diabetes. However, he has not been compliant with his medication and has a history of intermittent use and occasional double doses. So now we've got a focused letter, everyone. We've started with a simple sentence. Then we've got a coordinating conjunction, however, to express contrast. And then we've used the fanboys conjunction and to create a compound sentence where we've joined the compliance. He has not been compliant. And we've joined that with the examples of the non-compliance, history of intermittent use, and occasional double doses. Okay, we've shortened it and it's clear and it's professional. That's what you need to do. All right, and I can see a few. Just be careful with your sentence structure here. Notice I haven't used a complex sentence. I've just used a compound sentence. Compound sentences are excellent for presenting facts, everyone. You use complex sentences when you want to express some reason behind something, or perhaps some contrasting or unexpected outcome. You're going to use complex sentences then, but you will find that compound sentences are very common because they're useful for just presenting the facts. Okay. And you can see some classic errors that people make. Someone wrote in, his GP was prescribed metformin. His GP was prescribed. That would mean the metformin was for the GP. No, that's your active passive. His GP prescribed metformin. Someone wrote, Mr. Edmund, who is diagnosed. We don't normally say is diagnosed. I would say he was diagnosed because the diagnosis was made in the past. Okay. All right, let's continue, everyone. So this one we're going to rearrange. You're a health professional at Underhill Clinic. A new patient, Mrs. Melanie Wright, consults you about pain in her left knee. So this is a physiotherapy example, everyone. So medical history. So we got the 23rd of September 2003. Let's imagine that's today. Presenting problem, intermittent medial left knee pain, score 3 out of 10. How would you describe that as 3 out of 10? Can we put that into words? Well, we may choose to use that because it's valuable technical information. Some swelling, intermittent tightness, it's L for left posterior thigh, occasional lower back pain, not related. If it's not related, then we probably don't need to include it. Current background, 2 weeks ago, patient turned suddenly while walking and felt something pop in her leg, and then says increased gym exercises for 3 weeks. Oh, that's something that had happened. So we've got an interesting timeline here, everyone. We've got today's date here. Let's assume that's today. And then we've got a history. We've got to find out. That's when she presented. But if we look further back, the pain actually started, the issue started 2 weeks ago. And then 3 weeks before that, there'd been an increase in gym exercises that may have led to the problem. So we've got a 5-week timeline here, everyone. A 5-week timeline. Let's have a look. So here it is, everyone. Gym exercises on the 19th of August. That's when she increased gym exercises. That went for 3 weeks. Then on the 7th of September, that's when she turned suddenly while walking and experienced that injury for the first time. And then this is the date she's seeing you, 23rd of the 9th, where she's got that intermittent pain with some swelling and tightness. Yes, Carolina, exactly. Slight pain, manageable pain, mild pain. Not no pain. 3 out of 10, there is pain. Dull. So a lot of good words coming in there. Thank you, everyone. Just checking if I'm on Facebook at the moment, everyone. There we go. Got that loaded. Okay, hello to our OET Centre Facebook channel as well. I can see you all there now. I'll just type in a greetings. Okay, so how are we going to write this one, everyone? How are we going to write this? So we've got Mrs. Wright present. I'm going to help you with this one. Mrs. Wright presented. So we've got the date there. So here we go. Today. Let's imagine it's today, everyone. So there's your first bit of paraphrasing. You don't have to put the date if it's today, just write today, because that's the day you're writing. You've got the date at the top of your case notes. So we don't have to repeat that. Mrs. Wright presented today, complaining of. What did she complaining of? Well, here 2 weeks ago, a 2-week history of. There it is. A 2-week history of intermittent medial left knee pain. And that's a great phrase to use, everyone. A type of history. There are many types of history. A past history, a recent history, a strong history. So you can define the type of history, everyone. A 2-week history of intermittent medial left knee pain. So we're borrowing words here. Intermittent, we're borrowing. Obviously, the medical terms, we're just copy and pasting, but you've got to fill in the gaps. Excellent sentence there by Shadi. Well done. Let's continue. And we put, notice the use of the brackets, everyone, because this is a professional to health professional. So we've used 3 out of 10, but we've put it in brackets. It's a nice way to do it. That's relevant information. That's medical detail that if this was going to a physiotherapist, for example, they would probably want that numerical value. You can just put it in brackets like that. With concomitant swelling and intermittent tightness of the left posterior thigh. Now you can see a few things happening here. What are we adding, everyone? We're adding the preposition of, because it's that, this is nominalization, tightness of the thigh. And we're adding, there's no article here, but you need to put it in because you're talking, it's a body part. The thigh is the body part. Use a definite article for body parts. If you remove these little, the mechanics of the language, these prepositions and articles, it really does impact on the understandability of your writing and also the flow. So these little details are important. The symptoms, what are we going to put here, everyone? The symptoms, something when she turns suddenly while walking. So now we're talking about this date, 7th of the 9th. Shadi says, why not in instead of? You could use in here. You could. If we wanted to put in here, in the left, if you want to be specific, then you can say it's in. That's quite good. If you use of, it's saying that the tightness is of the thigh. It's more like a diagnosis of posterior thigh tightness. Yes, the symptoms started. Yes. And I'm going to add one more word there. The symptoms first, and you could say first started or first occurred. That's quite useful to put that number, that they first occurred. That just makes it clearer for the reader. The symptoms first occurred when she turned suddenly while walking. There it is. Now we're going to use prior to, everyone. It says here prior. For 3 weeks prior to what, everyone? Prior to the onset. That's a bit of a tricky one. For 3 weeks prior to the onset, the start point, everyone. For 3 weeks prior to the onset, she, can anyone put a verb tense here? Now we've gone all the way, have a go at this one, everyone. We're going back a long way in time, everyone. We're talking about this period of time, and we're way over here. And we've got the word, you get a lot of arrows in that in OET writing, so we've got to summarize this word, but we've got to get the right verb tense, everyone. Have a think about that. Past perfect, often a good one here. Yes, Denise. Some people are saying increased, some people are going had increased. I would go for our past perfect because it had increased. We're talking about the reason why we use a perfect tense, because it happened. We're talking about the pain, and we're actually describing this period of time here between the 19th and the 8th. So this, everyone, for grammar, this is past perfect, something that occurred for a period of time leading up to a past event. And over here, everyone, this is your present perfect. And present perfect leading up to now. So make sure you've got that clear. And present perfect is with the has plus the past participle ed. Past perfect is with had plus the past participle, describing something that occurred over a period of time. All right, looks like people are doing well there. Great work, everyone. Okay. A few people, yep, good. So timelines, everyone. OET. What I would suggest to you all is really study your timelines. We do a lot of this work in our live courses at OET Online. Very, very important part of medical writing. If you can't describe the patient's timeline clearly and accurately, you're going to cause confusion to the reader. So a very important skill to master. And also one of the most challenging aspects of OET writing, getting that timeline right, getting your verb tenses and your time references aligned. So really work on that, everyone. Work on that skill. Okay, we're going to do a dentistry example here. Any dentists in the audience? Type in DT if you're a dentist. Just type that in. But this is good for everyone. So because really what you're doing here when you're studying and preparing for OET, it's not just narrow, it's not just for doctors or nurses, which is a common profession. Just remember, you're part of always think of the bigger picture. Getting comfortable with different genres, different other health professionals is very useful in your preparation, and you can face these types of scenarios in other aspects of the exam, in your reading or in your listening. So very good to build your vocabulary in all areas of health. Okay, so that's English for medical purposes. So I've got, we're going to use synonyms here. And is there a way to express the condition and symptoms medically? Now this is if you look at this image, we've got a root canal happening here. And it says your patient, Mrs. Joyce, needs endodontic treatment to complete root canal therapy on one of her teeth. Okay, I've got my notes there. Mrs. Williams, I've got a date, 2nd of April. So there she had 37, that's a DO, distal occlusal tunnel. And she had deep 60%, there's a 60% possibility of RCT, needing root canal therapy. So here's my first question to you guys. A 60% possibility. Can you give me a word that describes a 60% possibility? I'll keep reading. On the 19th, so we're looking at our timeline. So this is more than a year later, everyone. Always pay attention to your dates. On this date, she had a 37 again, and this is a distal buccal tunnel and a temporary IRM, that'll be dental jargon, and she will need an RCT, that was decided. But then it says, patient concerned about cost, okay, wishes to delay the treatment, too expensive. Then 2 weeks later, patient complains, pain in 37 again, so the pain's come back, and now she wants that root canal therapy. Then, and that was scheduled for the 10th of the 4th, 1 week later. But then she cancelled it because the pain had gone away. So that's pretty challenging. The patient's not sure whether to go ahead with this treatment. Now, some people are putting in words, yep, 60%, that's a high possibility, probable, a high chance, likely, yep. Let's have a look, everyone. Mrs. Williams was, now we've got this, was first is a great word, or initially, was first advised she might require RCT. So there's our word, everyone, might. It's just a possibility. So she was advised, that's what you did, was first advised. We're using passive because you advised the patient. Some people are putting in strong possibility, excellent. You could say she was first advised, there was a strong possibility she would require. So Mrs. Williams was first advised she might require RCT of tooth 37 12 months ago. So another good strategy there. Imagine we are the 10th of April, because this is the date we've got. So let's imagine we're 10th of April, going back in time, 12 months ago. Be creative in the way that you use time references. This has a lot more meaning 12 months ago than putting a date. So more meaning when you phrase it like this. After a DO tunnel restoration. She was initially, what was she? She was initially something to undergo RCT. Can anyone give me a word for that? She was initially something. Mohammed says, why use may, not might? You could use may in that sentence, Mohammed. You could use may. That would be acceptable there. But might also helps indicate the tense there as well. Okay, she was initially advised. Yeah, no, but we're talking about her, concerned about the cost. Hina's got it, well done. She was initially reluctant, so she wishes to delay, therefore reluctant to, there's our synonyms, to undergo RCT due to what, everyone? Patient concerned about cost. Have a go at that, everyone. Badri's asked a question, isn't that judgmental? What do you think is judgmental, Badri? Let me know. Due to what? We want to summarize this. Patient concerned about the cost. What word could, she's concerned about the cost. She doesn't have enough money. It's too expensive. Something to do with finances. Yes, here we go. Wow, Denise, financial concerns, the financial cost. So I've got here, patient concerned about the cost, financial constraints. You could say due to the high cost, but it may not be a high cost. It just may be relatively high for the patient. Inadequate funds. That's good expression, Amar, but we don't know that she has inadequate funds. She may have an adequate funds. She just doesn't want to spend that money. She may want to spend it on other things. Okay, so due to financial constraints, everyone. Okay. Badri says, I mean, when you're 60%, no, there's no judgment, but that is, I think, perhaps not judgmental, but that is subjective. Might is expressing possibility. Okay, continue. But she agreed to proceed once the tooth became. What did the tooth become? Patient complains of pain. Pain is a noun. Let's use an adjective. Once the tooth became what? What happened? Nice and easy paraphrasing there. And now we've got a date because we're getting closer to today's date. Once the tooth became painful. There it is. So that's OET all over. Just got to modify your words. The appointment was, now I want to show you a time reference here, everyone. I'll do this for you because it says then, this is the result of that. The appointment was, and we got down here, root canal appointment cancelled. The appointment was subsequently cancelled when the tooth became. Give me a synonym. Pain gone away, everyone. Pain gone away. Give me a medical term there. The appointment was subsequently cancelled when the tooth became, another became, everyone. Pain gone away. What's the medical term? Painless, possibly. Drop off, no. Pain-free. Keep going. Totally different. Oh, yes, thank you for that. Little typo there. That should be 2020. Yes, Lulu. Well done, Lulu. That is correct. When the pain became asymptomatic. Asymptomatic. So use your knowledge of medical terminology in your writing to help create that professional tone to your writing. You know, there is a category in the OET criterion. You know, one of the criterions states genre and style. So you're writing in a medical genre here, everyone. So using terminology like this, very good. Okay. Now you can say when the pain subsided, or when the pain subsided would also be very good. But this is talking about the tooth. The tooth itself became asymptomatic. Okay, let's do another one, everyone. Time is flying by. Now this one is, again, this one is, I wanted to show you this one because sometimes you have to write to patients. A lot of professions have letters where they're writing to a patient. So this is all about expressing technical terms in patient-friendly language. So if any pharmacists out there, pharmacists often have to write to patients. It says Panadine for paracetamol and codeine for pain relief. Okay, that's what she needs to take. And we've got the dosage, and also Maxilon, which is metoclopramide. And we've got the dosage there as well. And then we've got a section on adverse drug reactions. And it says here for codeine and paracetamol, adverse, constipation, abdominal cramps, nausea, vomiting. These are the drug reactions. And then rare. So the rare ones, maybe we don't have to mention all this. Dependence, tolerance, impaired alertness. That's for the codeine and paracetamol. And then for the metoclopramide, we've got adverse CNS disturbances, including impaired alertness, tardive dyskinesia. Okay, so we've got a lot of medical terms, and we can't really use those terms if we're communicating to a patient. They may not understand. So we've got to use layperson's language or patient-friendly language in these circumstances. This also occurs in your OET speaking, everyone. So let's see how we do this, everyone. Panadine Forte has been prescribed for pain relief. and should be taken. Okay, first one, Panadine for, it says here, 500 milligram max 4 hourly PRN. 500 milligram max 4 hourly PRN. How are we going to express that one, everyone? While I'm waiting, Rafi says, can we say he was a chronic smoker? I think, Rafi, that sounds to me like a good expression, a chronic smoker. That sounds good. As needed, yeah, PRN, as needed, excellent. Or as required. But then we got max 4 hourly. Now, max is hard. So we've got to use a phrase here. I'll do this one for you. But not more than every 4 hours. When required is good. Someone said as per required. No, as per, after the word per, you need a person's name. As per the doctor's orders. So don't say as per required there, Sanabur. Just say as required. Every 4 hours as needed. Very good, Elvis. And I've got here, but not more than every 4 hours, or with a maximum of 4 hourly. Okay, that's good, Alina. This medication can cause constipation, nausea. Okay, can you give me a synonym, everyone? Can you give me a synonym for abdominal cramps? Synonym for abdominal cramps. And while we're going, to counteract these, while I'm waiting on that, to counteract these symptoms, Maxilon can be taken up to, so we've got 10 milligram TDS. And please note, although rare, both medications can cause, I want to see if you can give me a synonym for impaired. I want an antonym here. Well, impaired alertness. So the opposite of alertness, everyone. I'm looking for an antonym. Opposite of alertness on the last one. So have a think about that. Okay. Saad says colicky, abdominal pain, but not really for writing to a patient, I'd say. But abdominal discomfort is good. Abdominal pain or just stomach ache. And I've got here, everyone, stomach aches. There you go. Can cause constipation, stomach aches, and nausea. Bloating, I don't know if that's specifically accurate here, Samiam. We've got to try to match the meaning exactly. To counteract these symptoms, Maxilon can be taken up to what? Wow, people are doing very well here. Up to 3 times a day. Please note, although rare, both medications can cause. A lot of people are already putting it in. You could put disorientation, Alina, but the word here we're going to use is drowsiness. I'm not going to use stupor because that's not patient-friendly language. All right, and there it is, everyone. So we've softened the language. So if you do have a situation where you are writing to a patient for whatever reason, and it does occur for some professions, then just be aware of the need to soften. Sarah writes tummy pain. For me, tummy pain, I'd probably say it's a little bit more for children. All right. So, wow, everyone, we're done. That hour went very quick. That hour went very quick. So, hope you got some benefit here. Wonderful to do this session again for those people who weren't able to attend the live session last time. But just remember the 8 rules, everyone. Study that, go over that, and apply that to your writing, and you will see your level go up. All right. Now, if you do want to practice this kind of thing with us live in our classes, do come along. We run live virtual classes twice a day, Monday to Friday. Great time slots for all regions. Ahmed said, that's for another lesson. Ahmed, what's the KISS method? That's not being romantic. Ahmed says, what's the KISS method? Everyone, the KISS method, and this is a good strategy, everyone. I should tell you this. KISS is keep it simple, Simon. Keep it simple, Simon. So in other words, that means don't use too much complexity in your writing, everyone. Don't use too much complexity. Okay. Rafi asked the question, can we put comma in introductory before who? It depends whether it's a defining or non-defining clauses. So Rafi, Google that, defining and non-defining clauses. Now, next session, everyone, we're going to do, we're not going to be too far away. In another couple of weeks, we'll be back. And at this stage, we're looking at doing a nurse scenario, everyone, a nurse writing scenario. All right. Nimra says, can you explain fanboys? Maybe for another session, Nimra. All right. And if you want to know when we're coming, check it out on the OET Center website. You can see the schedule, everyone. So you can see the schedule there if you go to the OET Center website, everyone, or just come to our website, everyone. If you want to know the schedule there, it's on our website. I'll give you the link so you can find it there easily, everyone. If you want to know the schedule, just visit this link. Just putting it there in a few pages, everyone. And look, just so you know, I just want to tell you about writing, because today's sort of focus is writing. So if you're not, how many of you are already studying with us? Type in, you're already a student with OET Online. Just type in OET Online student now. If you're considering, then just type in considering. And look, we got great budget ones, everyone. Writing self-study. If you're on a tight budget for just Australian $25, you can get all this course content for your writing self-study. Practice tasks, model letters, strategies, our grammar and vocabulary clinic. It's all there for you. And a 3-month access. That's all profession specific. If you want writing correction, we're doing great work and we're helping so many people pass writing with our writing correction service, everyone. We got the best teachers you can imagine, very dedicated to helping you. And you can get 5 correction plus all your practice material for just $112.50. What a bargain. Consider that. It can make a real difference. Then if you got difficulties in writing, or you want, you know, maybe you really, you know, writing is hard. Then you got our virtual writing class standard, virtual writing class platinum, 2 options there. And basically the platinum has a bit more, but 2 great options with corrections. The platinum has 8, the standard has 5. The platinum has actually a lot of lectures. It's got grammar lectures on Monday and the profession-specific writing lectures on the given day for your profession. Remember, we do writing lectures for doctors only, writing lectures for nurses only, writing lectures for the allied profession. So we divide those up. I think we're the only provider who does live classes for the allied profession. So if you're an allied profession, join us. But we have great courses for nurses only, doctors only. And finally, I'll introduce the ultimate, everyone. If writing is tough and it's essential that you pass OET, maybe you've got ECFMG registration coming up for the USA. Maybe you've only got 1 shot you need to get through OET for your PLAB exam, or whatever the next step for you is. Well, if writing is hard, try our ultimate course. It has everything that you need, including 2 private writing tutorials. It's still great value. at Australian $3.95. I know that's not accessible to all. You decide based on your budget, everyone, but really great options. So you don't have to do all skills. And even Mai says, I only need reading. Go to our single skill options. But as I said earlier, everyone, come and check out our free trial course and try before you buy. See if you like it. Happy to show you around. You can even do a trial live lecture. And if it suits you, jump on board. All right, everyone. Wishing you good progress. See you in the next prep hour.